Hello, I'm Dr. Varsha Saxena, a pediatrician and a pediatric sleep specialist at Anexas Clinic and Manipal Hospital. So, are you all disturbed with your baby's sleep schedule? So, one thing I want to assure you, you are not alone, and most parents have to undergo this phase. Sleep is one of the most important part of baby's growth and development, but it is very confusing for the parents. So if we can understand about the newborn's sleep schedule and sleep cycle, it will help in decreasing the parental expectations of the newborn's sleep, anxiety in the parents, and know that the frequent waking is normal and it will pass out in time. So most parents are perplexed and don't know why the baby's sleep is so disturbed. So first of all, we should know that the newborns sleep 14 to 17 hours in a day. But they have a frequent sleeping and waking up cycle. This is because their circadian rhythm is not developed. So the babies have a sleep burst and waking up. This circadian rhythm is not developed because of the melatonin hormone, which is secreted in the newborn's brain after 2 to 3 months of life. So till then, the babies have a frequent waking, and they don't know what is day, what is night, and they keep waking up in the day and the night. Another thing is the adult sleep pattern have a sleep cycle of NREM and REM sleep. So the babies follow an active and non-active sleep. And the sleep cycle of an adult is for 90 minutes and for babies for 50-60 minutes. So there is more frequent awakening. Plus, this active sleep which the baby is most of the time in is similar to an REM sleep. That is, there are rapid eye movements of the babies and some muscle twitchings. So you may feel, although the baby is sleeping, the baby is having a disturbed sleep. But these minor movements of the baby during sleep are normal. Another issue for the baby is that the baby's stomach is very small. So they require feeding at frequent intervals. So that also will make the baby wake up at frequent intervals. And the baby's liver is also developing, which is more in the preterm babies. So this liver is not able to maintain the blood sugar for a longer time, and the babies have to be fed at frequent intervals, otherwise their blood sugar may fall. Especially for preterm and SFD babies. So now we understood that disturbed sleep and frequent waking is normal in the child. What the parent should do? One thing, the parent, the mother, especially the mother who is feeding the baby, should follow the same schedule as the baby, because sleeping and waking up with the baby at the same time. Then there are 5 S of making the baby sleep. The one is swaddling. So if you can swaddle the baby, it helps to keep warmer and baby sleep longer. Then sushing. Babies are inside the womb. They normally hear a small whistling sound. So if you can make a constant sound in the ear of the baby, sometimes they sleep better with that. Swinging the baby, most of the people use cradle or jula, and that helps the baby to sleep. Sucking, normally babies like sucking while sleeping. So lip movements of the baby, if you are seeing, it's not a hunger because they want to suck something. It can be a pacifier or just your finger for some time. It can help you sleep better. Breastfeeding can be done, but don't make it as a habit, because later on it becomes very difficult. So because the baby only sleeps when the breastfeeding is done. Side position or stomach position. Normally we should always keep the baby on the back position, but for some time if you keep the baby in the side position or tummy position, it helps, it releases the gas and the baby gets longer. Expose the baby to the morning daylight. because the sunlight falls on the eyes and it helps to regulate the sleep. It is the main factor which helps in melatonin secretions, so the baby's circadian rhythm will develop better. Encourage rooming, means the baby should be inside the same room where they're sleeping, but do not try to do bedding. Means the baby try to be for the first few months, but try as soon as possible make the baby sleep separately, because the baby will learn how to self-soothe himself or herself for sleeping better. So, disturbed sleep in early months is normal and not the sign of poor parenting or unsettled baby. Thank you.